Uh, Call this meeting to order, McLean County Behavioral Health Coordinating Council, Friday, December 9th, 2022. Amanda's already taken attendance up here, so we'll just move right on to number 2, approval of the minutes of the October 14th meeting. Is there a motion? Motion by member
Second.
Foley, second by member Taylor. Any comments or questions? Hearing none, all in favor, please say aye. And opposed. And the motion is carried. Good morning. We'll go ahead and go to item 3, items to be presented for information. Scott Block is here with us. Welcome.
And we're still trying to sort out some audio issues real quick, it looks like, looking for the external audio.
Okay, at the last meeting, I talked about that NACO leadership network that I'm involved in, and that there were going to be 3 technical systems calls and 2 site visits. So far, we've had 2 of the TA calls. And you've received the report, the final report from Tri-West, and it kind of validated a lot of the recommendations we had in the update. Well, the TA calls kind of did the same thing, that kind of indicated that we're on the right track. So the first TA call was with Corporation for Supportive Housing, and it was myself, Kevin, and several members of the Fuse staff. And you all know that the biggest challenge we have in McLean County for just about anybody is housing. And we wanted to know if there were any strategies that they could help us with on that. Other than pay for success, that's still an option, as it is in the recommendations in the update. But there were other suggestions that they made, were some on like master leasing, creating low barrier shelters similar to Salvation Army, where individuals don't have to be clean, because that's one of the biggest issues with some of the shelters and some of the other housing. LA County had something called Project Home Key, where they had bought hotels, and I think Ms. Taylor can remember that I had approached her about buying Jumers when it was for sale. For the same reason, and for supportive housing. So there were several other counties. They suggested we look at what they have done and how they approach that. And then they gave us some suggestions on pursuing data sources to identify the frequent users of crisis, EMS, and hospital EDs that aren't homeless or don't have have little justice system involvement, where our tool is not indicating that they are a frequent utilizer, because we have not yet been successful in obtaining data from those systems. The second TA call was with TASK, which is Treatment Alternatives for Safe Community Center for Health and Justice. And one of the things that we had asked them for information is, how do we evaluate all of our diversionary programs equally, and all of our programs that provide mental health and substance use supports. So the suggestions they gave us align with a lot of the collaboration, coordination, and the justice-involved recommendations in the mental health action plan, possibly a combined strategic plan between BHCC and CJCC. And they also acknowledge that we have Illinois has an added challenge of CESA, 988, Safety Act, and AOIC, and so that we have a constantly moving target with trying to do some things. So our last TA call will be in January with Bazelon Center for Mental Health Law. So then for the first site visit, I was pleasantly surprised that it wasn't just going to be me. They are allowing someone else from the communities that are participating to bring a team member. So This is all paid for by NACO and Arnold Ventures, and so there were several choices that could have been made as to who would be a good participant to join me, but I ended up picking Kevin um, to go. We're going to go to Bexar County, Texas, which is San Antonio, and we're going to have a day and a half that is like starts at 7:30 in the morning and ends at 8 o'clock at night. And to learn about their behavioral health and justice system of care. Some of the topics and locations are going to be like an overview, law enforcement and their legal system diversion, crisis collaboration, their leadership, their funding, data sharing, one of the outcomes metrics. They have a shelter campus and they have a reentry center, so we're going to be visiting those locations. So they, you have to remember that there are 1.4 million people, so some of the things there are never going to work here, but we might be able to glean some information that we can make some improvements. And then I'll provide a report or a presentation at our March BHCC meeting, and I might, talk to people before that. And then what's also exciting about that trip is that some of the counties that were mentioned for us to look at in the CSH technical assistance call are also members of the leadership network, and they'll be there so we can actually have a lot more in-depth conversations with some of the things that they're doing. So that's kind of exciting too. So that is all I have. If anybody has any questions, you can ask me now, or if you can contact me later if you have questions.
I just wanted to chime in and say I'm grateful for Susan's work on this front, and those technical assistance calls have been really great and invaluable when we look to our potential expansion of the FUSE program and the continued work we're doing to know that we're on the right track, and kind of seeing what other folks are doing and best practices there has been a huge help to have their assistance. So thank you very much.
Thank you. How are we doing with Scott? Sorry.
Hey, Scott, can you say something again real quick, see if we can hear you? It's registering, but not coming out for some reason. We're still going to work on that. Yeah, I don't know, Dan, can we have him, can we call him in at all? I mean, whatever you think's best. No, I have his cell number. I'm going to call him right now. Hey, Scott, I'm going to give you a cell phone call, and we're going to have to put you on speaker here. We're having some technical issues, and this is probably the only way we're going to be able to do it. I'm calling you at 312-793-1876. There you go.
All right, you can hear?
Is that being picked up okay?
I can hear you on my end.
Okay. Yeah, that's, I mean, yes. Yeah, do we have any external speakers or anything else we could, I don't know if there's any other way to do this.
I can sit tight if you'd like. I have no other meeting scheduled.
Because I can do my presentation, even though it will include some of the things that Scott talked about, and we can continue to work on this, Dan, if you think that there's a solution. But beyond speakerphone on my broken cell phone, I'm not really sure what our options are. Yeah, please. Yeah. I don't know, Dan. What do you think if we have someone else connect? Will your audio be louder, perhaps? Yeah, I'm not going to do that. Is this over here? Could I just have you read that one? I'll give you the number real quick.
We're going to move on. And while they're working on it, you can come back and see if we can get it up and running.
Did you get your slides going? I think we're ready. Okay, we'll have Mr. John Tree go then. It is 312 793 187.
Dan, will that pull up mine? Yep.
Hello?
Ooh, that doesn't sound good. And then we'll come back to Internet Explorer.
Can everybody see the, so I'll go ahead and I'll just ask Dan to go ahead forward. So I'm happy to give everyone an update on the Bridge Academy. Just for a little background, we did start our classes just after Labor Day with completion of construction. Go ahead, Dan. Next slide. We currently have 16 students enrolled. We've got 2 more awaiting their intake meetings. That'll be completed here in the next week or so. We actually were up to 18. We had 1 student that became readily apparent in the first week that we were not an appropriate placement. They actually needed a more intensive placement. And then we had another student who actually moved out of the region. So we have had subsequent inquiries from a few other districts this week, so I anticipate we're probably going to get some more referrals as we look to coming back after Christmas. Just as a reminder, we're serving students in grades 7 through 12. Of that group, we've got 7 that have a 504 plan and 2 that do have IEPs. 7 of our 8 districts in McLean County have currently got a student that is referred to us, so we're serving those, and then the remaining students are coming within my region. Go ahead, Dan.
Mike, remind us what a 401 or a 703.
A 504 plan, thank you, yeah, remind me not to get into lingo. 504 plan is for students who don't qualify for an IEP and special ed designation, but they may need some accommodations. They could be medically related. They could be some other ones. So it's a legal document that the parents and the school district agree to provide some accommodations for the students. And it could be any type of thing, like I said, medical, extra time, things like that. So, but it is a legally binding document that does travel with the student. So we make accommodations based on what's in that for those individual students. So.
And the other one?
The IEP is, so a student, if you're familiar with the term a special ed designation, those students qualify for special ed services. That spectrum could be anything from as simple as speech and language services to fully blown intensive outpatient, or residential placements. So if they're a residential placement, they're not with us though.
I might
So,
remember this next time. We'll see.
yeah. Thank you for holding me accountable on that, so I'm not talking too much lingo. We're currently at approximately 50% capacity based on our current student dynamic. And when I say dynamic, the population and the personalities of the students that we have and what we've got staffed. We currently have 3 teachers, 2 caseworkers, therapists, and then Tricia is the director. So we can comfortably serve 30 and 36 students. And our capacity, we feel, will be around 40, 45 if we needed a 4th teacher at this point. So, but given our current enrollment, we're comfortable with that. Go ahead, Dan. So this is one of the things we're really looking at in terms of how successful are we being at the outset. So if you look at that, the top one, 39% was the average full-day attendance for the students that we have. And then as of yesterday, attending Bridge, they're just under 70%. And then you can see the median from 29 to 78. So when we talk about one of the main purposes and challenges of why this program was needed is because these students were not going to school by and large. And so this is a great indicator that we're moving them forward in their ability to cope, and hopefully eventually we're going to be able to transition them back to their home school. Go ahead, Dan. So we did a student survey response because we felt like it was important to get student feedback on how we're programming and what we're doing. And so you can see on there, on a 5-point scale, 83% of the students would rate their experience as a 3 or better on a 5-point. And that same amount would has stated that they believe they've improved in some way regards to their mental health since they've started with us. And a third of those would agree they've seen improvement, but they're still looking for more growth as well. I'd take you down to the 5th bullet point. We asked the students which core values they believe are generally embodied at Bridge. They overwhelmingly identified respect for all, inclusivity, perseverance, which is one of the biggest things that we need to help them with, sense of safety and compassion. And then they also identified that respect for all is a value that needs to be improved the most. And then we did a follow-up, because when you ask that question, you get that response. Who are they talking about? Are they talking about staff to students, student to student, so on? And so in the follow-up, it is student to student, peer to peer is what they had more specifically identified. So, and I think that reflects some great awareness on their part. Go ahead, Dan. I think I've got one more. GAD-7 is the reassessment. It's generalized anxiety disorder assessment tool. And so of the students we have, 5 have improved their scores, meaning the score is decreased, which is a positive improved indicator. 1 has maintained. We've got 4 that haven't been there long enough to have had a reassessment. No, I'm sorry, I don't know what I did. I failed to ask Tricia how long it requires. So if you're going to ask me. 4 students have worsened anxiety, and you can see the note that Tricia's made there that is not unusual in the first 30 days. So that's kind of where we're at. I will give you a couple of just individual anecdotes from a couple of students, just to give you a little context of some of that data too. When I go back to the attendance, we had one student that was at 9% attendance. So out of that entire average, she is currently over 80% attendance, so tremendous growth over that. They used to only make it through an hour or so and coped by texting parents, has now learned those coping skills, staying in class, and is really completing the schoolwork. And incidentally, so academic data, the end of the term is next week, so we'll have some academic data at the end of next week. And another student had multiple hospitalizations in their history, can now identify when those urges are coming on, and without action and using coping skills both at home and at school in order to regulate themselves. So we've got parents reporting students spending more time with them at home than isolated in their room, which was another common issue that was prevalent among the population. And they're opening up more to mom and dad or their caregiver. And we had quite a few students who've actually been able to overcome their anxiety and actually get employment outside of the school day as well, which is huge. So having said all that, there's still struggles, but we feel like we've got things to celebrate and moving forward. So I would tell you we're really pleased 3 months in as to where we're at. And we continually get calls. We get referrals that they're just not appropriate. And so we've had some that we've turned away. But we are very, very cognizant of what we can and can't do. So I'll open the floor up to questions, Mr. Chairman, if that's all right.
Anyone?
Yep, I got a question.
Yes,
Yeah.
Dave?
Mark, a couple of questions. One's a follow-up from the last time. I know that District 87 and Unit 5 were kind of working through what their intake process would be. How has that been resolved?
So they have referred kids since the last
Okay.
time. So they've worked through that process. I think we have 2 from 87 and maybe a handful from Unit 5
Okay.
at this point.
And then kind of a follow-up question to that, on a personal level, I know that our oldest has talked about friends that are doing online school because of anxiety, and they're in Unit 5. What's the gap, you think? Do you have an idea or a sense of what the gap is with these kids that are suffering from anxiety and they're doing online school, but maybe would be a good fit to Bridge, but there's just not the capacity, or they just haven't been referred yet? Like, do you have an
I think
idea of what
it's-
the market, I guess, is?
It's potentially they haven't been referred yet. The districts are still trying to see if they can work that, and maybe it's not necessarily the anxiety mental health component. It might purely be a medical, not knowing specifics and things like that. So, but I could certainly follow up and ask.
Yeah, I was
But
just curious if you have an idea of how many kids are possibly in the waiting area, if you will.
No, I think so. we are continuing to get referrals from the district, so some of them, they're still coming through and that, and we've gotten more calls for potentially more placements. So it's a matter of them referrals and some paperwork, and honestly, a little bit of it might also be educating the parents about what this opportunity is. And so, good question though.
I wanted to tag in on that a little bit. I might suggest also making sure that some of the pediatrician offices are aware.
Thank you.
Because in my experience, sorry, in my experience that there are physicians that are at times writing for youth to not have to attend school due to severe anxiety, which then sets the school in a position of saying, okay, well, we can't make you attend, so we have to provide it another way, without always understanding that that actually hampers improvement, right? And so there may be some of that challenge too with the school districts having kids out on a medical note, not being able to make that referral yet.
Thank you. That's a great suggestion and one we will follow up on.
Anyone else? Well, thank you, sir. Appreciate it. So we backtrack a little bit. Are we ready yet?
Yeah, so it looks like we do have Mr. Block on the phone
Okay.
for us now back here. If we can get the volume turned up, I think we're ready for him.
Can you hear us, Scott?
I can hear you. Checking on my audio.
You might need to mute your computer, but does everybody hear him? Yes, everybody seems to hear him.
Testing.
We're okay here. Let's go ahead.
Computer is muted.
You're coming in loud and clear here.
All right. Thank you, guys. Apologies for any inconveniences this morning, and thank you, Chairman and council members, for the invitation back. I do have a couple of points of interest that I think will be helpful to you moving forward, specifically based on the comments I heard from Ms. Schaefer. First thing I wanted to talk about a little bit is an update in response to the implementation of the Community Emergency Services and Support Act, the CESA bill, and then the second would be the forthcoming plans from the AOIC and the Illinois Supreme Court. So I'll go ahead and start with a couple of updates in response to CESA. I did meet with the DHS implementation team yesterday and was informed that the General Assembly did sign and approve legislation that moved to the governor to essentially delay implementation until July 1st of 2023. So the governor has not signed that yet, but it's anticipated to be signed within the next couple of days, and that will allow further time for planning and implementation. The other points of interest are that since we spoke last, the CESA advisory committees and teams have all been formed, and all the chairmen and co-chairmen of those 11 advisory councils throughout the state have been trained in how they need to deploy their further actions and move forward. It is my understanding that your county falls within the EMS Region 2, and on that council, there are a few names that I have for you that you may be interested in by way of follow-up. The chairman is an individual by the name of Michael Barr, and the co-chair is Dennis Duke from Unity Point. And then specifically from McLean County, there is a 911 representative on your advisory committee team, and that is an individual by the name of Rhonda Flagel. So what I would say at this point is if you have not connected with any of those individuals, you may want to connect with them. I know they have not convened their first meeting for your region yet. It's anticipated that that meeting will take place sometime in December or early in the new year. These will all be public meetings and compliant with Open Meetings Act. So even if you are not formally on this advisory group, you can either attend those meetings either virtually or in person, however they'll be held. So This is the space where a lot of the planning will be done in response to developing protocols, policies, procedures, whatnot, all around CESA. So again, encourage you guys to get involved with that. The other thing is that there are 4 official committees created by DHS and the CESA implementation group, and these 4 committees have all held an initial meeting, all again which are subject to Open Meetings Act and can be attended by any interested party. But there are committees on developing overall standards, developing and looking at what data needs to be collected and reported, how things are being communicated and promoted, and then training possibilities. So those 4 committees are organized under the official CESA advisory implementation team with information posted on DHS's CESA website. So it is the intent of each of those 4 committees to develop some type of toolkit and resources that will be distributed throughout the state. One of the items that is being worked on right now is an update to a myth and fact sheet about CESA, which is specific to law enforcement, and that is intended to, again, help alleviate some of the misinformation that's out there. So I'll stop there. I think those are the primary updates on CESA, and I don't know if there are any questions or anything else anybody would like me to address on that before moving forward.
Thanks, Scott. We'll see if anybody can communicate to you if you can hear us. Okay, do you have a question? Yes.
Scott, this is Cassie Taylor. Do the councils have a deadline for when those standards and policies need to be put in place and presented for public review?
Now it is proposed that deadline moves back to the July 1st, 23 timeframe, so that they should be convening actively between now and then to develop all their EMS regional procedures and policy and protocol.
Thank you.
Other questions?
I don't have a question, but I do have a comment. Megan Moser from our crisis team should be on that. She was invited to be on the regional committee also, so.
Okay, could you hear that, Scott?
Okay, I could not hear that comment, sorry.
That's all right. There was an additional member on the team from the crisis team from CHS that we're familiar with. You want to go ahead then and proceed?
Sure, thank you, Chairman. The other update I had was in response to the AOIC and the Illinois Supreme Court's Mental Health Task Force Action Plan. And I see that Judge Foley and Judge Robb are both there today. So good morning. Glad to see that you guys are part of the Behavioral Health Council. Just to provide everyone a brief update, I did attend the Conference of Chief Judges last Friday and provided them with a similar update. And then I did speak with your court administrator, William Scanlon, earlier this week to make sure he was aware of some of the forthcoming plans. As I talked about last time I was with you, the Illinois Mental Health Task Force partnered with the National Center for State Courts, and we spent the last year hosting resource mapping workshops based on the sequential intercept model, deploying a community assessment, and meeting with justice partners and stakeholders throughout the state to determine how we wanted to move forward. And through that process, we engaged about 800 individuals, including judges, court professionals, behavioral health professionals, and all of our state agencies. And the information that we collected, gathered, and shared was rolled up and developed into an Illinois Mental Health Task Force action plan. That action plan was presented to the Illinois Supreme Court during their November term and was met with unanimous approval. So the next steps in that process were to, again, present to the Conference of Chief Judges so that as we move forward, there'll be no surprises to them. But within the next week or two, the chief judges and court administrators throughout Illinois will all be receiving a memo from the court along with a copy of the plan for their review. I will say probably the biggest ask of the court within that plan, which could potentially have some impact on your Behavioral Health Coordinating Council and Justice Coordinating Council, is that the court and task force is requesting that all chief judges appoint or dedicate a single judge as a point of contact for this effort within their circuit. And then we are asking that individual to act as a convener and leader of future discussions, which would include decision makers from all of the different disciplinary individuals that fall within that sequential intercept model. So we learned from Miami's efforts in Judge Leisman, that he convened the decision makers for a number of months and even years until they were able to really determine a shared vision and understand one another's barriers and systems before they were able to really move forward in a meaningful way. Throughout the national task force effort, we are learning that judges have the quote-unquote gravitas to get people in the seats consistently, and that's why there's a request to have a judge lead future meetings. Within those meetings, we would hope that there would be representatives from, again, county officials, as well as law enforcement, police chiefs, or corrections, I should say, as well as behavioral health providers, and any other system leaders that should be at the table. So it is my understanding between your Justice Council and Behavioral Health Council, you have all of those individuals represented, maybe just at different times. So the intent isn't to duplicate work, but it's to make sure that there is cross-system communication. And throughout that, our task force members and myself will be available to offer the judge any type of technical assistance and resources that are needed to help drive those discussions locally. So within the plan, there are actually 37 recommendations, and they're broken up into 8 different sections, which are based on the sequential intercept model. So we have recommendations at each of the 5 intercepts, but then we also have recommendations under 3 other categories, one being courts as conveners and leaders, another one being developing awareness about court and justice-related needs, and the third around increasing training and multidisciplinary training opportunities. So within all of those recommendations, there are some that fall directly under the court's control and purview, things like examining and analyzing how we are responding to individuals that have been found unfit to stand trial. We know throughout the state and the country that there are people that are languishing in jails that probably don't need to be there while they're waiting to be transferred into DHS custody. I do not believe you guys have an outpatient fitness restoration program in your county, but that is certainly of interest to both DHS and the court to see more of those types of opportunities throughout the state. And then we'll be looking at things like the civil mental health opportunities that are afforded to us already under the Illinois Mental Health Code. When you talk about the frequent users of services and some of the homeless populations, we have seen involuntary outpatient treatment or agreed orders for outpatient treatment be pretty effective with that population in certain areas. So we'd like to see how that could be expanded. And then there are a number of other recommendations that are built more around just kind of, again, training, awareness, advocacy, and cross-systems communication. So February 2nd, we'll be hosting a statewide webinar to essentially make this plan public and start promoting it throughout Illinois. So I will be sure that Kevin receives the invitation, and all of you would certainly be invited to listen in on that web event. And then after that, we'll be following up with our chief judges and court administrators to move things forward. So that's where we are with the Illinois AOIC's action plan.
Okay, any questions? Pretty much okay. Okay, thanks. You want to move forward?
Thank you. Appreciate the opportunity to be here again.
Thank you, Scott.
Thanks, Scott. Anything else?
So next up, we actually have the triage update from Joan. We're kind of skipping around a little bit here, but if there's not any other questions for Scott, we'll hang around for a little bit. You have something
Thank you. So, um, thank you. We will be fully transitioning the newly titled program, Behavioral Health Urgent Care, which was the triage center, over to our 520 North Center building, which is our tower building, on January 1. We have been working very hard to recruit staff to make it a 24/7 program. We're having a little bit more luck with peers just because of my association with Heartland Community College. I'm trying to recruit every student I have in class. But we are having difficulty still recruiting bachelor's level staff to pair with them. So we're still working on that. We're currently working on creating all of the processes and documentation in our EMR to make sure that we can accommodate the new program, developing policies and procedures that are gonna enable us then to certify and license the program under our license. And with that, we're also creating then a billing structure to be able to bill for services to Medicaid. And we did hire a coordinator. She starts on Monday. Kim was very excited about that so that she doesn't have to come in on weekends and overnights. So in the future, we're planning to continue to recruit and hire staff, develop a marketing plan, and then we'll implement that very comprehensive marketing plan once we have set hours. We don't want to do it too soon where we would frustrate people where if we couldn't be consistently open during the times that we said we would. So that is our one fear. So, and then we also were in communication, or I've been in communication with Department of Mental Health, and they indicated that at some point during this next year, they will be releasing a NOFO for living room expansion of living room models, and so we'll be on the watch for that too. So, any questions?
I didn't understand what you're referring to when you said expansion of living room model.
The state has funded living room models in around the state, and they're going to release another NOFO to fund additional living room models. And so our program,
Model, just more sites?
it's yeah, they'll add more sites. Yeah. Yeah, so I've been told that because we would be operational, we'd be in a really good position to be awarded a grant once that comes out and we apply for it. So, yeah.
Recruiting volunteers and just recruiting anybody to work right now seems to be an issue, right? So what you're saying is there is a concern that you don't want to promise and not be able to fulfill.
Right. I know that just my experience, I think all of our experience in the past when we've had programming where we've had to change hours or we've had to make any changes in terms of availability, people get very frustrated when you're changing that a lot and then they just quit using you. And so we don't want to set that up in the very beginning. We want to make sure that we've got a sustained, at least one shift that's sustained across the board that we can open, and then we can always go back and say, oh, yes, and now we've got these hours too.
When you do outreach marketing, what all areas are you thinking about touching base with? Obviously, law enforcement.
Right. Law enforcement, we also think it's really important to let the public know, which is the reason why we decided to change the name to the Behavioral Health Urgent Care, because we really felt like when we utilize the term triage, we all understand what that is, but I don't know that my neighbor really understands what a triage is and what you do there. And so because urgent cares are pretty widely known on the medical side, where it's the one step before the emergency room, we felt like that would probably be easier for people to understand. And so we'll do a lot of marketing to the general public along with other providers that could potentially make referrals. And of course, we'll talk to the hospitals and that, so.
Okay, thanks. Any other
Yeah.
questions?
Joan, who can I talk to about, I guess, exclusionary factors? Because, with the changes in bond reform, we've been looking at additional alternatives for officers if someone is not appropriate for detention, have to be released. We found, as we all know at this table, the huge gap is for people who are under the influence. There's nowhere in this community really to take people who are under the influence. And so I don't know if that's going to be an exclusionary factor, who I can talk to, so then I can relay that information.
We'd be happy to. Kim Fryman is the person who is heading up the project. So we'd be happy to talk with you further about that, Judge.
Okay, other questions?
So you made a comment you're having trouble hiring staff. So are we still using staff, or who's actually running this right now?
Well, so I can comment on that. So they're still in the process of transitioning and bringing some folks on to do all their onboarding stuff that they would need to do under the Center for Human Services. And we have been able to successfully transfer some folks from our old triage program under McLean County to the new program. And so the supervisor that you discussed coming over is Vernice Prince, who formerly worked for our triage center. And so they just have a little bit of training to do over the next couple of weeks. We will be closing triage effective today at our site at the health department, but are hoping to reopen January 1st is the target date. And so there'll be some training and getting everybody up to speed at that point, and I will definitely be assisting in trying to recruit for those purposes.
So you just said that after today, triage is going to close?
Yeah.
So it's going to be closed until January 1st?
Yes.
Okay. To everybody?
Yes.
Okay, thank you.
Yep. And I will be sending out an email after this meeting to everyone who was involved with our change of hours that we let out to the community last month.
Joan, is it 18 is still the limit to
Yes.
access service? Yeah.
So we got a holiday season and there are people experiencing problems, maybe at a higher level or at least a larger percentage. And now we're going to be closed? Seems like to me that's sending a message about bad marketing.
Yeah, I mean, so we have had an RFP that's been open for nearly 4 months now. And so that transition process, it's taken a lot of time because there's a ton of work to do. Kim Fryman, I've been working very closely with her, and really it's just difficult to open a triage center, as the county knows very well in our effort to do it. And so while we, don't want to close for any amount of time, I think we've been extremely lucky, and I'm extremely grateful to the folks that have stayed on, knowing that we are transitioning this program into an entirely different organization, and to have hours every single day of the week over the last couple of months, these people full well knowing that either they're going to transition to an organization or have to look for new employment. I can't be any more happy or satisfied with the way we've been able to continue our hours. So while it's tough to have a few weeks where triage services won't be available, in order for us to do this the right way and to set out with hours that are firmly established and not have to retreat and change some of those, this is the way that we have to do it. And so I think that we're going to be looking at a much stronger triage center going into 2023, and these are the steps that we need to take in order to get there right now.
We will be open on New Year's Day. So when we say January 1, we mean January 1. We'll be open on the holiday. So,
Any other questions? Anything else, Joan?
no.
All right, thanks a lot. Let's go on to item 4C. Kevin, we're back to you on the Fuse program.
Yeah, so we're going to jump over to this presentation now up here on the screen so we don't have to deal with any more audio issues. This presentation, I'm not sure how long it's going to take. I know some of you have to start dropping out of here around 8:30 or close to the hour mark, and so I will make this PowerPoint available to everyone. And if you have questions related to specific actions or goals as we go through some of this, please feel free to reach out to me, and I'll try and answer those questions as best I can.
So just to be clear, you're skipping down to 5, you're not speaking on RISE.
No, I'm speaking on all of those things. Actually,
Okay.
that's going to start the beginning of this presentation in there, and then 5, it kind of is going to transition halfway through, so we can make that point when we get there. So first, I'd like to give a Fuse program update, and I'm going to introduce our Fuse program supervisor, Nicole Kirstein, who's going to touch on that briefly.
Good morning. So some quick updates. To date, Views has served.
Mic really close, please.
You can pull that.
Okay.
Close to you. Very, very close. This close.
All the way up. Speak right up.
All of that.
Is that better? Okay.
There we go.
To date, Views has served 22 people. Currently, we have 12 people that we're currently working with, and one that is joining us next week. We have done outreach to a lot of people. Some of them didn't qualify because of our eligibility requirements. We did have 6 people that were eligible, but for various reasons decided not to join the program. So I want to point out that 7 of those 12 people that we're currently serving were new in 2022. Some success stories. Currently, we have 7 people that are housed, which is pretty impressive with the current housing crisis right now. 2 of our clients are currently employed. One of them has been employed for over a year with his current employer since April. So that's really exciting for him, and it's been exciting to see him grow his confidence and his skill set. Before Views, people had on average 3.5 ED visits, and we are down to 1.25 visits on average. Jail contacts were 9.8 contacts before Views, and we're down to 2.45. One person in particular stands out. He had 5 jail contacts before the 18 months before Views, and he has not been arrested in the 39 months that he's been with the Views program. Our rough estimate is he's probably had about 50 arrests throughout his life, and he has not been arrested in a couple years. And when I told him that, he just started crying and was so impressed, and he called his mom right away, and his mom, they had a moment and they were crying. It was really nice to see. And for shelter contacts, we have gone down from 1.95 to 0.65. And I think that is it for the clients. For continuing education over 2022, our RN has achieved her psychiatric mental health nursing certification. One of our staff, she just recently applied to become a certified recovery support specialist. And she also was accepted into an MSW program. Sarah Stelter, she is also in her MSW program, and she just is finishing up her internship. So we're excited for her to graduate pretty soon. Sarah and I both attended the EMDR training earlier this year, which is eye movement reprocessing system, or desensitization therapy. Whew, yes. And we also, or I think Sarah did part of the DBT training, but I also completed a 3-day course of DBT training. And I'm excited to announce that we will be having a new staff person that we'll be looking for a case manager position with Views next year. And do you want to go on?
So I'm happy to say we completed our first BALC site survey last week. We got the surprise phone call from the state on Thanksgiving week, and so it was all hands on deck for that, and I'm happy to say that we completed it 2 days early. We're working on addressing some of the very minor issues that came up to get our policy and procedures, looking 100% perfect, but I was really happy and satisfied with our team. And it was definitely a huge relief to have that over with. Anytime you have someone coming into your site and setting up camp and going through all of your files, that's pretty tough, but I think it says a lot about the groundwork that's been done for Fuse over the last few years to make it very easy for me to complete this and to make sure that Fuse is able to stay in business. And they had a lot of really great stuff to say about the program. So thank you to Nicole and all of our Fuse staff for their continued hard work. I'm also happy to say that we are nearing the end of our EMR implementation, and so we will be able to bill for services when appropriate. We've been working with CureMD to get this done, and so we're really kind of at the last billing component here and going into some live training and really starting to carry this out. We have a variety of tablets and signature pads that we'll be using out in the field with this program, where we plan to spend more of our time out in the community working with clients as opposed to having them come into our office. That was certainly a difficulty during COVID, but in 2023, it will be something that we're focusing on quite a bit more. And we're doing our EMR implementation in coordination with reassessing our referral requirements. So we have some self-imposed referral requirements that need to have, our clients need to have contact with 3 different entities: the justice system, the ED, and then HMIS, or homeless management information system data. And we're just kind of reassessing how each of those are used, what each of those counts really means, and potentially expanding some of our services to be more of an a la carte menu in 2023, where we might take on individuals who need specific services but are not necessarily a full Fuse client engaging in all of our services. So that's something we'll be exploring as the need is there. Okay, so I want to update you next on our RISE initiative. For those of you that are not familiar, this is our county's trauma-informed initiative. RISE stands for Resilience Inspires and Spreads Everywhere. This was originally started in 2021, but was rebooted this year under Vanessa Granger-Belcher and Taylor Davis. I'm happy to say that with Taylor's departure, we've been able to stay on track with our action plan, and we will meet the end of it here in December for not only our core team, but also our data and metrics subcommittee and our training and development subcommittee. And so a couple of the things that we've worked on this year is we've developed our training materials that we use not only for regular individuals in the community, in which a presentation was given at the Behavioral Health Forum by Keith Brotheridge that was received very well. But we're also working on presentations for organizations and social service organizations, a variety of entities in the community, to educate them on what a trauma-informed community is, what a trauma-informed workplace is, in order to engage these places to become trauma-informed organizations. We've developed shared language, which is a lot harder than it sounds, to agree upon what trauma-informed language is appropriate to use in the community, what's applicable to, again, our professionals versus our lay people. And then using that language to develop plans for branding and marketing related to our trauma-informed initiative. And so that's something we'll be focusing on a lot more in 2023, is really getting out again into the community and starting to do some of these projects and various things that we've cooked up in this last year. Looking at communities like Tarpon Springs, who we invited to come to RISE and present and tell us how did they create what they consider a trauma-informed community. Not really trying to reinvent the wheel here, but looking at outside communities and seeing what they do best and what things might fit well for McLean County. When it comes to developing a trauma-informed community, it is definitely not a one-size-fits-all approach. Every community is very different. We've seen that with pretty much everything in McLean County, and this is no different. We will be starting to brainstorm what our action plan looks like for 2023 throughout this month, and we are looking to hit the ground running in 2023. In that same vein, I'm happy to introduce our new assistant director and our RISE coordinator, Sarah Stalter, who's joining us today. Sarah has been with the county for several years now, and she's been working with our Fuse program. We had a ton of terrific candidates, which I know is pretty rare considering the hiring difficulties I know folks experience around the table, but we had a good 15 applicants and we interviewed all of them. And we had, PhD candidates and all sorts of great stuff in there. Folks that I hope will look to take positions elsewhere in the community, but Sarah was the right fit for us, and I know she's going to do a tremendous job with her skill set, specifically with RISE, also in planning the Behavioral Health Forum, which we'll start planning at the beginning of Q1, or maybe more towards the end of Q1 next year. But both things that I know she has a terrific skill set and the ability to take on. So I'd like that for Sarah to quickly give herself a brief introduction, but thank you. I talked about her a little too much, I guess, but if you'd like to introduce yourself.
Took all my points. Good morning. As he said, my name is Sarah Stalter. I've been the recovery support specialist with my CRSS since August of 2019, about the time that Fuse got up and running. At that point, I was in coordination with Chestnut Health Systems, and since then have become full-time at the county until part-time this past year while I've been doing my internship with Boston University. I'm excited to join the BHCC community here and work with RISE. I've been involved with the Behavioral Health Forum in the past, and I'm a mental health first aid trainer. Very passionate about talking about trauma, and I'm really looking forward to working with everybody here. So, thank you.
All right, thank you, Sarah. Okay, so now I want to get into discussing more specifically the actions, the goals, the metrics of the Mental Health Action Plan and BHCC in general. So one slide I just wanted to put on here, and this is something that gets discussed frequently, but I think it bears repeating, especially on a presentation like today where we're somewhat recapping the things that we have completed in 2022. I want to mention that in our next BHCC meeting, we will do, again, a rundown of accomplishments in 2022 and be able to kind of flesh out the entire year. Obviously, we're not to the end of the calendar year yet, and also more in detail discuss some of the financial aspects of BHCC. So what is the Mental Health Action Plan and how is BHCC meant to function? Most of you by now know the history of the Mental Health Action Plan. You've probably been a part of this group longer than I have. And so what I really wanted to talk about was some of the misconceptions. And so the Mental Health Action Plan was created in 2016 to improve the behavioral health of McLean County residents and create systemic change through innovative programming and strategies. I want to jump down and read the vision here, and this is highlighted in the Mental Health Action Plan, a direct quote. The BHCC would serve as a forum to discuss differences, facilitate communication, align strategic plans, and assist with the pursuit of external funding and technical assistance. The BHCC will be a conduit of information sharing between the council, other counties, and regional mental health organizations. And I wanted to put these two on here just to highlight what the exact purpose is of BHCC, and it is to be a place for us to convene and have discussion and to share ideas. But very often I get approached for various programs that have been conceptualized that are in the beginning stages of being thought out. And I get approached to, hey, we have this great idea. Do you have funding for it? And I feel like very, very common, there's this misconception that because we have these dollars that are associated with BHCC through the shared sales tax, that funding all goes directly towards meeting the objectives in the Mental Health Action Plan. And I want to dispel that notion and let you know that the Mental Health Action Plan is a community effort. And BHCC very much is here to help move forward those community efforts, but we don't always have a dollar amount to attribute to every goal listed on the Mental Health Action Plan. And so I just want to make sure that we're very clear on that point, that if there are things on here that you feel your organization can work towards meeting on the Mental Health Action Plan, I will do everything in my ability to make those become a reality. I don't always have money to give you or a check to write for you in that regard. So the Mental Health Action Plan in 2022, if you haven't had an opportunity to read this document in its entirety, I would strongly encourage it because there's some really terrific stuff in there. And I think it's a really great overview of a lot of aspects of mental health and behavioral health in our community that many of us might not have a great understanding on because we work outside of that specific scope. And so the recommendations within this document identify focus area, action, the who, the when, and goals and metrics to identify positive change. There are 7 different sections outlined in this document. Recommendations for McLean County government, justice involved, collaboration and coordination, crisis, youth, and access to medical services and medical management. And so what I would like to do is go through some of these goals right now to show ones that are in progress, ones that we're looking to target early in 2023, and ones that might be a little bit further down the road. Located in your packet, you'll see past the presentation, there is a printout of all of these goals for ease of reading. I know that this is pretty small, especially even up here on the PowerPoint, and so in order to save your eyes, that's there for you to look at as well. So kind of starting at the top here, the very first section in the Mental Health Action Plan, are recommendations for McLean County government in general. The first one is to advocate for changes to the Illinois Mental Health Code aligned with HIPAA and 42 CFR Part 2 through local legislators, statewide county organizations, and other avenues. And so this is one that is on the legislative agenda and maybe you can specify for me, Susan, can you give me a little bit in detail about the legislative agenda and how this is on there and what the plans are for it?
Look, it's just an item that we, when we work with our lobbyists, that they know that we are interested in updating the mental health action, or the mental health code in Illinois,
Okay.
which I also believe is something that Illinois Supreme Court and AOIC recommendations might come out and say too. And so that way our lobbyists, if there happens to be a bill that gets introduced, that they'll know to pay attention to that, and that we're interested in, then would probably get back with county administration as to how they want to, how they should proceed on our behalf.
Okay, thank you for clarifying that. And then we have action number 2, actively participate in the refresh of the integrated justice information system with integration of mental health components. Again, this is one that County Board, CJCC, and Aegis work groups are tasked with working on and selecting the vendors for the 5 integrated components. The last 2, 3, and 4 on here are both directly related to the crisis work group that we'll be rolling out, and I'll be talking about at the end of this presentation. Creating a data governance group for information and data sharing, starting to discuss some of that, how that would work specifically within our crisis work groups, and then maybe how that would relate to other sections of the mental health action plan in regards to data and information sharing. But also creating and executing business associate agreements for information and data sharing is something that I'm already in discussions with related to our crisis group, how we would carry out some of those business associate agreements. And again, that's something that our TA calls have also been helpful in trying to figure out how is this done in other communities related to sharing that information. All right. And so I tried to somewhat break these up a little bit into completed or in progress versus coming soon. I think that categorization is a little bit ambiguous, but I tried to do my best to break it up so that you could understand this a little bit better, kind of where some of these goals are at. You'll see in the when category that the times range anywhere from year 1 to year 1 through 3 or year 2 or 3. But I think in a lot of ways, most of these goals are still ongoing or starting to go in some form or another. Action 5 is continue engagement with the Data-Driven Justice Initiative community to share ideas and solutions. And so obviously we had an update today in regards to that. We're very much still involved through our Familiar Faces initiative and planning to visit the great state of Texas in January to continue that work. We're also evaluating dispatch and law enforcement data to identify gaps and needs. We have outreach currently in process to try and gain some of that data and begin to evaluate it and set up kind of a standard reporting procedure where we can have a template to come in and discuss those items each BHCC meeting. And then number 7, in 2023, we're looking to acquire a grant writer. So we will also be out there looking for an individual to add to our team to help increase our ability to bring in outside funding. I think it's something the county has wanted to do for quite a while to help, that collaborative aspect as well. Again, this is someone who will work to serve BHCC. And so if there are ideas that exist out there in the community, funding opportunities that you're looking at, and you think, man, I just don't really have the time personally or with my team to commit to this grant writing the way that we need to in order to get funding. This is a position we hope will fill some of that gap and that need that's there in order for us to just bring more money into the community in general. Okay, and continuing, the next section here is our justice involved. And so again, number 1 is part of the legislative agenda, advocate for changes to the Illinois Mental Health Code to align with HIPAA and 42 CFR Part 2. And then action number 2, advocate to retain local control and decision-making when addressing mental health issues. That's very much something that we do by the nature of convening BHCC, is to talk about these community issues and trying to see where our role can be in each of them, including through things like bringing in Scott Block to know what's coming down from the state, what's happening on a wider scope, and understanding where we can step in to advocate and retain control. All right, actions 3 through 5. So actions 3 and 5 are both in year 2, and so those are something we'll be focusing on in 2023. As we look to further collaborate with law and justice as we attempt to tackle behavioral health issues in a more unified way. So we have create a public awareness marketing campaign for the Safe Passages program. I know that we now have a new sheriff, and so I'm looking forward to the ability to collaborate with them and market that program. And then 4 and 5, formalize diversion strategies at intercepts 2 and 3 and promote awareness and utilization of recovery court. These are all things that we'll be working on as we look to greatly increase our collaboration with law and justice, with CJCC across the board. And so now we have 6 through 9 for our justice involved section. 6 is request data sharing relationship between CJCC, Stevenson Center, and BHCC. A relationship with Stevenson Center is one that's reoccurring on here for our needs to analyze data. And so that's something we'll be pursuing in a couple of different regards. You'll see in the goal and metrics section for action 6 that requesting an annual presentation from statewide behavioral health administrator is one of those items. And we have had Scott Block here several times in recent history, and he's been able to kind of give us the inside scoop on things coming down from the state. So I'm happy to say we fulfilled that one, at least partially. And then coordinating efforts between the Criminal Justice Coordinating Council and Reentry Council. That's something that we are continuing to look at, taking in the advice of Scott Block and seeing what are the best ways to continue to advocate for that effort. 8 falls under justice involved in this section, but it's something that is kind of pervasive through all of the sections, and that's recruitment of psychiatric services and psychiatrists. So while there is potentially more of a need related specifically to the justice involved section, we have been getting a ton of outreach from organizations asking for us to look at ways to expand psychiatric services. And so there is no end to the projects that we're pursuing right now to see what's viable for this community. Related to this, I've specifically worked with the nursing program through ISU to see what they might be able to do in collaboration for providing psychiatric nurse prescribers, and working with the shelters here who are seeing some increasing difficulties with getting prescriptions for individuals that come into the shelters and aren't able to expand their 15 or 30-day scripts, and how we might be able to provide services for them. But really just pursuing any avenue available for us and expanding psychiatric services. And that's a reoccurring goal that you'll see in the other sections as well. Number 9 on here is participate in the Illinois Supreme Court sequential intercept mapping and regional council work groups. And so, yeah, we're in the process of still getting involved with that and collaborating and working specifically with CJCC to that end. The next section here is collaboration and coordination. I've tried to squeeze all of them onto one page here, so there's kind of a few on here. Number 1 is in reporting, and that's utilization of the logic model to achieve goals and problem solving. And so there are a couple of goals and metrics in here that call for specific templates and reporting. And so our hope is to kind of combine the two and utilize logic models to highlight inputs and outputs and all of those various things in the templates that we will use for our reporting. I think this specifically will relate to the work groups that we will be rolling out in the way that they will report their work to BHCC during our quarterly meetings. Number 2 is to create focus work groups to research a topic and provide a report at the next Behavioral Health Coordinating Council meeting. Again, this will come from our work groups where we will be focusing on specific and targeted issues and be not only wanting to, but expected to report to BHCC on the progress that those various groups are making. Number 3 is a year 3 goal, but exploring the data and requirements towards standard data collection for aggregate reporting and outcomes is something that is certainly already being discussed among those individuals that will be participating in our crisis work group to see what kind of legal barriers, what kind of technical barriers do we have in sharing various types of information, whether that's just using a standard reporting template or getting data uploaded in real time for the air traffic control style of system that we'll discuss for the crisis group in a couple of other slides. Action number 5, annual review, the behavioral action plan update recommendations. So this is somewhat part of that process and going through these actions and goals with you all, but we will have kind of a more comprehensive review and a complete yearly review going into our next meeting. Number 6 is to advocate for capital funding for infrastructure, which is an ongoing goal at this time. This rounds out the end of our collaboration and coordination section. So action number 7 and 10. Discussion on DEI topics has occurred through our RISE initiative, but this will take on its own work group in 2023, following the results of an initial survey and that data from behavioral health coordination. So we will carry out individually an initial survey and then use that as the basis for our work group to target what kind of things do we want to focus on in this community related to DEI. And then number 7 as well also relates to that. So 7 and 10 I've grouped together on here. Number 8, we hope to begin using a standardized reporting template in tracking all efforts related to mental health first aid and report on that again in each of our quarterly meetings. I think that's something that's been lacking here that we've kind of more sporadically given information on, but something that we like to do a repeated and standardized report on as well. And then action 9, incorporating an older adult peer specialist, is a year 2 goal that we're still in the process of conceptualizing our efforts. Okay, and now we are on the crisis section. Action number 1 is develop and implement a method for real-time communication between providers of crisis services. So this is something, if you look in the goal and metrics category, establishing a work group with BHCC members. I've been doing a lot of work behind the scenes to engage stakeholders that are engaged in the crisis system to see what kind of things do we need to discuss in this work group? What kind of things do we think are going to be possible? What kind of information do we need to explore going into this group? And I think that we have really a good foundation kind of set for what this group could potentially look like. And I'm very optimistic, especially with this work group in the crisis system, that we can do a lot of really strong work in 2023 to create some very tangible improvements quickly. And I'm hoping that that group will be the hub for that change. Action number 2 is evaluating the ability to provide CIT training for all new first responders and CIT refresher courses for those previously trained. We're still waiting on some information back from the departments here for 2022 data, but we do know that in 2021, I don't know the exact month, at 1.100% of officers did have training. And so we're hopeful that that is going to be close to what that number reflected. Obviously, we would like to have 100%, but we will be reporting that on that again in our next meeting as well. Okay, so completed or in progress. Action number 3, retain an active role in the stakeholder groups for the implementation of 988 and provide guidance when needed. And number 5, reconvene the Community Crisis Planning Committee quarterly. So again, these are things that are going to be talked about and discussed under that crisis work group, and things that I've already been discussing with some of our crisis stakeholders in the community, especially involvement with 988 and coordination with PATH, and how all of that is going to relate to CESA, and how we handle crisis calls as they come in the community, and how we field those and deal with those various situations. And so all of that will probably be folded into that same work group, because it will require a pretty large group of individuals to be at the table to flesh out and determine how is this going to end up looking at in our community, and how is the crisis system going to operate. And then we have coming soon is 4 and 6. We still want to try and reconvene the NYU pilot. I know that it is still continuing in Indianapolis, and some of the other actions on here required looking at the EMS data that we had related to that pilot. And so we have made outreach to them and are trying to figure out how can we continue some of those efforts, and working with the NYU Criminal Justice Lab to be a part of what was a really good I'll say field study. Next, we have our youth section, and so this is going to be where our second work group is at that we'll be kicking off very soon. Action number 1 on here is convene a group to evaluate best practices and implement for prevention and earlier intervention prior to entering the school system. And so there are a lot of different, again, goals and metrics here within this youth section that I think very much will be discussed and tackled within the work group. And again, is a group where there's been a lot of conversation in the background and ahead of time leading into the establishment, formalizing this work group in order to make sure that we're bringing the right people to the table. And so everyone that is a part of BHCC will obviously receive a formal invitation to these work groups. But if you know of individuals that you think should be connected to these in any way that would be valuable to providing information or having a voice, feel free to extend those invitations to make connections to me personally. I would love to talk to these folks before they came into our group. We have got a lot of outside interest from individuals over the last several months, kind of people knowing that these groups are coming, especially at the forum when the chairman and Cassie and I gave a presentation. We were approached by a lot of teachers and counselors in the schools who want to get active in the community and participate in these groups. And they already are a part of many and very wide-ranging work groups, but bringing their expertise and those knowledge from those individual groups within the community to a main group, I think is going to give us a really strong understanding of what's going on in the community, issues that are coming up recently, and how to best tackle them. It'll be a great place to have those conversations. Yeah. Dan, it looks like oh, am I out? Okay. Okay, so we have action 6 through 9 for our youth section still. So increasing professional development for professionals working with youth of all ages. Number 7, scale the embedded schools project to expand to additional schools and districts. 8, continue to explore and support prescriber and provider options. And 9, explore expansion of peer curriculum at Heartland Community College. So these are all things, again, that I think will be discussed and worked through in the community through this work group. That's what my plan or intent is of the work group, at least to be, is for those things that would fall under the purview. We would certainly work towards achieving those goals and metrics within that group. The next section here is access to medical service and medical management. Actions 1 through 3 are completed or in progress. Action 1 is develop enhanced methods for data sharing for case management to improve the continuity of care. Again, this comes to some of our initial work that we'll be doing in our crisis work group, but obviously this is somewhat separate. Again, just trying to further our data sharing efforts. Number 2 is exploring integrating Carl Broman with Unity Point to increase access to psychiatric services while providing more options for care. Again, this is those psychiatric services coming up as a goal or a target for the county to work on increasing options or access to care. And I actually yesterday spoke with Dr. Burgundy Johnson through Carl, who is a psychiatric provider, and working with them to understand what resources they have available, what kind of expansions they're looking at of their services, what kind of availability they currently have, and then starting to pick the brains of people like Dr. Burgundy Johnson to figure out what kind of avenues do we have for increased collaboration within the hospital system here as it relates to the rest of the entities within McLean County, and how do we continue to increase collaboration to grow psychiatric services overall. Number 3 is supporting the use of telepsychiatry. This is something that's coming up in all of those same conversations, is how is telepsychiatry being best utilized, not only here in the county by existing organizations, but across the country. With COVID, I think telepsychiatry is being pushed more than ever, and it's something that we're definitely looking at as a means to resolve a unique issue that we have in McLean County with being the largest geographical county in Illinois and having the majority of our resources located in Bloomington and Normal is reaching those more rural communities with psychiatric services when they may need them. Seeing how we can continue to expand those or provide a different avenue for telepsychiatry is something that we've been discussing with existing providers in the community. And then coming soon for 4 and 5, 4 is a year 2 goal, education on benefits of practice of on-site or integrated behavioral health at primary care offices. And then 5, develop a strategy to maintain current behavioral health staff and obtain more behavioral health staff within the county. This is something that's been talked about a lot as its own potential work group. I've talked a lot specifically with Dave Sherrar about recruitment and retention and how we can kind of grow that and collaborate on that in this community. There's obviously a lot of competition when we have organizations that are all fighting for the same types of candidates, and really thinking about how can we work together to get and keep candidates without so much infighting. How can we recruit more folks? How do we keep people here in the community after they graduate? Trying to explore all the potential options to make sure that McLean County can recruit and maintain the best professionals available. And so now we're on to housing. And so while our group doesn't necessarily, or behavioral health coordination as a department doesn't always have a direct influence on the things related to housing, it is a major part of the mental health action plan because it is such a major issue, not only in this community, but across the country, especially when it pertains to folks with behavioral health issues like those that are in our FUSE program. And so action 1 and 3, educating the public on what supportive housing is and is not, and partnering with MCRPC to assist with best land use and location and supportive housing. Those are in use now or in progress now. We're starting to conceptualize how MCRPC, myself and Raymond Lai can Raymond, I think I'm getting his, is it Lai, L-A-I? Lai, I got it right? Thank you. We met last week, actually. I started to kind of give him a rundown of the mental health action plan and talking about some of these goals and how we can collaborate, as well as the issues that we're starting to face and a lack of not just affordable or supportive housing, but housing across the board in this community that's, you know, creating somewhat of a crunch for everyone that's looking for housing. And as we approach the winter months, it's definitely a group that I'm going to be in contact with a lot more. But in addition to just collaborating with MCRPC, also a part of the United Way Housing Coalition and working with some folks over there on a variety of different programming ideas that they have to help support individuals in our community where there is that cross-section of housing and behavioral health. Okay, and so 4, 5, and 6, again, these are all in progress, and so these are mostly encouraging municipalities in the first one to continue to reduce barriers for housing opportunities, and then promote and market opportunities to potential developers for multi-unit. And so this is 4, 5, and 6 are all, again, things where we are collaborating with MCRPC and looking to the county board to help to influence some of this decision-making and advocating for the various things highlighted in here as it relates to housing. Okay, I know we're almost out of time here, but I promise I'm getting towards the end. And then completed or in progress recommendations for housing. This should bring us to the end of our housing section here. Form a coordinated system for reviewing applications for housing assistance to maximize resources. And number 8, implementation of Pay for Success with FUSE program. 8 was referenced by Susan Schaefer. Sorry, Sarah. Earlier, and that's something that we'll be looking at, trying to reapproach. This is a year 3 goal, but number 7, again, is one that we're coordinating with the board and with MCRPC on. And so I want to talk a little bit briefly about our work groups. If you choose to be a part of these groups, you will definitely get a lot more information. So these are just the broad strokes right now. And many of you in this room have already had conversations with me related to these work groups and know very well kind of what the expectations will be. But the first one that we're rolling out is our youth work group. This is establishing a work group specializing or interested in youth services. It will report annually to BHCC. More likely will be reporting quarterly, at least for me, and then having the group do do a larger report annually. To evaluate best practices and implementation methods for prevention and earlier intervention prior to entering the school system. That is verbatim from the Mental Health Action Plan. But serving as a conduit of information sharing with representation from existing groups, as I highlighted previously. This is meant to be taking existing groups that work on youth and adolescent issues and bringing those representatives to the table to kind of have a larger group where we can share things from those other community groups. At least that is my hope. And so meeting invites will go out to all BHCC members, and just keep in mind what I said before. If there are other individuals who you think I should be connected to outside of BHCC that you think I'm not, please feel free to reach out to me, make those connections. I really want to get people involved that are excited about these topics, that, especially if they're already involved in carrying out some of these goals in the community. The second one is our crisis work group. We're establishing a work group specializing in those interested in crisis services, again, reporting annually, but again, quarterly as well. And this is one where there's probably going to be a lot of groups involved. And so I've talked to Chestnut and McLean County Center for Human Services, and really trying to tackle the transition of the new triage center and mobile crisis, and how all of those things are going to function together in coordination with the rollout of 988 and CESA, and coordinating with PATH and law enforcement and the hospitals. This is a group that I think is going to have several different subgroups probably dedicated to it once we really get going on some actionable items. But we hope to bring all of those people to the table for our first meeting to have some pretty broad discussion. And so I'm hopeful that both of these groups, many of you will be involved, and that they will be fruitful in 2023. The last thing I wanted to touch on before we end here and open it up to any questions you might have, I know that I've been talking for quite a long time now, is the SOC grant. We were given a potential timeline from Tri-West in our last special session. And we have finally got the scoring. Because my name was not on the actual application at all, I had to put in a ton of tickets with ERA Commons, and thankfully Cassie was able to work with me and we were able to get it sorted out. But I do have our official scoring. So if you were involved with that SOC grant submission, you can expect to get that scoring from me by the end of the day today. If you don't get it from me, or I missed you for whatever reason, please reach out to me and I'll get it to you right away. I've given it to Tri-West to evaluate and been talking with Jesse and those folks about our approach. But you'll also get a new updated timeline from me. I thought theirs was pretty aggressive for when it was started, but I know we're coming up into the holiday season too. I would like to get a couple of meetings on the books in regards to SOC and some planning for that before the end of the year. Okay, and here's my contact information. At this time, I think I'd just like to open it up for any questions related to the abundance of information. Yes.
One question.
Yeah.
The Tri-West report.
Yes.
Are you going to try and integrate the recommendations from that with the mental health action plan?
Yeah, absolutely. So this is something that I've reviewed with some other members in the community that were some of the larger stakeholders involved with that report. And we went through and looked at, well, what are all of the goals in the mental health action plan? And then what's outlined in Tri-West as far as the items they have provided for us for the transformational goals that they provided. And pretty much everything that's hit on the mental health action plan is outlined in the Tri-West assessment. So I very much believe that that will be a guiding document for us as we go into that group. I think that there's some extremely valuable information in there. And I think the recommendations were already in line with the mental health action plan and kind of where my mind was at for the changes that are needed here. Yeah.
Questions?
Kevin, I have a question from one of our virtual participants.
All right.
Kevin McCarthy asked, in regards to crisis action number 1, are you looking for a technical solution or something else?
Well, so let me make sure I'm looking at the right one. I think I know what he's talking about, but. Yeah, so we are looking for a technical solution to this. There are already some things going on in the community where a couple of organizations are trying to figure this out amongst themselves. more looking to see how can we do this on a community-wide level of being able to share information in real time. It's for our purposes, it'll probably start fairly small in scope with only a couple of organizations being involved because of all of the agreements that might be there. But it's certainly something where I'm going to be looking to our IT department to see what kind of ideas they have for carrying out sharing data in real time, and would certainly be open, Mr. McCarthy, to any suggestions that you have related to that.
Okay, anyone else? May I ask, the work group's going to consist of people outside of the Behavioral Health Coordinating Council members? Our work group's going to consist of people that are involved throughout the community besides just Behavioral Health Coordinating Council members?
Yeah, so it will, dependent on, yeah, I mean, anyone can participate in these work groups. I assume, like most of the groups that we have started or participate in, the people who are part of BHCC will comprise basically the core of that group. I'm looking to them to recruit members from the community that they feel would be needed in these types of discussions, but it is also open to members of the public to be involved.
Okay. Any other questions? Thanks, Kevin. Looks like you're going to be contacting a number of us the first week in January. Anyone else have anything for today? Our next meeting is Friday, March 10th.
Can I do one
Yes,
30-second?
yes. Judge
The
Foley.
Circuit Court of McLean County has received a one-year planner grant for Family Treatment Court. Family Treatment Court is a court program for people who are involved in the abuse and neglect system, but the parents have substance use issues. We're going to do a community kickoff on January 18 at 12 noon. I'm going to send an email out to all of you. Some of you have more interest than others, but we are going to start the planning process for that. So thanks for letting
Okay,
me
thank
announce
you.
that.
Anyone else? Thanks for coming. Happy holidays. Thank you. And we will adjourn this meeting.